put
Okay.
on the recording.
Yeah. Thank you, Christy.
Yeah.
I
Record.
think as often as we've done this virtually, I'd know.
Okay, so there's
So are we live on YouTube and we're recording?
yes. And now
Okay.
I'm trying to make Florence the presenter, but there's a bunch of Florences.
Florence, that's how important you are.
I guess. The one with the picture,
Yeah.
the real one.
Yeah, this maybe is a variation on What's My Line? Hi, I'm Florence Portello. Well, I guess there aren't too many of us on this virtual meeting that would remember What's My Line.
Okay.
So
You tell the
I
truth,
think you
that was the
shared
one.
with the wrong
Yeah.
ones. Sorry.
Okay, either one. It dates us a little. All right. We are live. We are being recorded. We are going to call to order the joint work session with the Siletz City Council. This is Monday, August 30th. It is 5:34 p.m. And let's do introductions. And I'm Doug Hunt. I'm chair of the Board of Commissioners, and I'll let the newest member of our Board of Commissioners introduce herself.
Hi, everybody. Good evening. I'm Katie Jacobson, and I'm one of the commissioners as well.
And Commissioner Hall.
Claire Hall, County Commissioner.
All right, and I believe, Willie, as mayor, you're present, and of course, Tracy, your city recorder, is with us. Anyone else from Siletz?
Does not look like it. Looks like it's just the two of us.
All right, well, we will proceed, and Florence Portal is our interim Director of Public Health, and as many of you may be aware, provides a weekly update to the Board of Commissioners. And before we start with her presentation, I will provide a little bit of background for people that may be viewing this or view it in its recorded form. Once a year, the Board of Commissioners gets together with each of the city councils of the 7 incorporated cities in our county and the tribal council. And it's an opportunity to discuss items of mutual interest in an effort to improve communication and really advance the activities that will benefit not only our different organizations, but our communities and the people of our county. So with that, we do have an agenda of 3 items. And the first one, as I was indicating, is an update on the COVID situation. And Florence, we'll turn it over to you.
I'm trying. You have to
Did we
pardon me.
give-
This is the first time I've actually had to do this. I'm trying to figure out how to turn it over to her.
Maybe we turned it over to the wrong Florence.
I think I did. And now I'm trying to figure out how to get it back.
So Christy, I just emailed you the presentation.
Oh, okay.
Yeah.
Maybe I should ask, who are the other 2 Florences? And I'm not sure how you would identify yourself, or can somebody identify them for us? Maybe I'll do it. We've got Carl, we've got Curtis, we've got Kristen, we've got Tracy, we've got Florence, and we got Will, Claire, Doug, and Katie. So there are 2 Florence Portels.
This is Jerry Herbage. I might be Florence. I don't see my name there.
You are one of the Florences. Okay, Jerry, that helps. And the other Florence?
This is Jane. It might be me. I too might be Florence.
All right, Jane, you too are Florence. So Florence, you are well represented tonight. And we'll turn it back to you, Florence.
Okay, I'm so
the real
sorry. My
Florence.
screen is different, and Christy, is there a way? Yeah, maybe to open it as PDF. Yeah, that's gonna be probably better.
Oh my gosh, hold on.
You know, Jane and Jerry, if you want, while we're doing this, if you go in the upper right-hand corner of your panel on the screen, and the three dots will provide a drop-down screen where the bottom item is to rename yourself. Florence, you ready?
I'm ready. I'm just waiting for the presentation.
Oh, okay. Yeah, Jane, good job. Now we'll leave it to Council Herbage.
Are you not seeing the screen?
I am seeing part of the screen.
Oh geez. Okay.
Yeah, we see it, Christy. Can you just advance to the next slide, or can you scroll so she can?
Or
Okay.
can you just click on the PDF?
So this one that I have on full screen isn't appropriate right now? Is it not working?
No, it can. Can you keep
Just
advancing?
scroll down.
Yeah.
Thank you, Jerry.
Can you just go to the next page?
I don't think she has.
I went through the whole thing just now, each slide.
No. So this is not, you're
Okay.
probably not sharing the proper screen.
All right. Let me see. Okay, so I'm just going to keep it on this. Can you see this now?
Yeah.
Okay.
Oh, there it goes. It moved. Mine did.
There.
Okay, so I reduced the slide deck quite a bit. This is so a few caveats on those slides. The slide deck from the state have just been updated, and they're up to date as of yesterday. So this is what happened for Oregon as a whole over the weekend. We had 5,545 new cases reported throughout the state. We see here on the Epi Curve a significant rise in August in cases, and it looks like the trend line is, starting to head down. I'm not gonna be too excited until we see that for maybe a few more weeks. But as you can see, in August, we've been between about a little bit over 1,000 to over 3,000 cases per day. Next slide, please.
There we go.
So the hospitalization graphs were not updated. It was old. It was the latest update was on Friday, so I didn't put it in there. But what I wanted to show here is kind of the cases in Lincoln County and the hospitalizations we've seen. So this is data from the week of July 4th until through the 28th of August. And as you can see, it's a very steep increase in cases. This past week, we had over, I believe, 250 cases reported to us. Our hospitalization percentages is about 3.1% of cases have been hospitalized during that time period, 25 people. Out of those 25 people, 21 were not vaccinated, which is 84% of the people who were hospitalized due to COVID-19 were not vaccinated. And when you compare the hospitalizations in July to the ones in August, we are seeing a 157% increase in hospitalization for Lincoln County in August. Next slide, please. So I thought I would show you, and hopefully this is kind of what you wanted to see, Commissioner Hunt. So what's going on with the hospitals in Lincoln County? So I thought we would talk about capacity first at those two hospitals. So North Lincoln Hospital has a total inpatient capacity of 16 beds and an ICU for adults only of 4. When they're staffed, they've been facing a little bit of difficulties staffing those ICU beds. And so today when they reported, they didn't have enough ICU nurses, and so they can't staff those beds. They can actually put any patients in those beds because they are not being staffed.
You want braids? Okay.
Pacific Coast Hospital, the total inpatient capacity is 25 beds. They have only adult ICU beds, and the capacity is between 5 and 6. And they have 5 COVID positive patients in the hospital at this time.
Excuse me, Florence, would that be a
Mhm.
typographical error? I'm assuming that should be Pacific Communities Hospital.
Yes, Pacific Communities Hospital, of
Just
course.
for clarity, thank you.
Thank you. And then I thought underneath I put kind of a sense, give you a sense of what was
Very
going
pretty.
on at the region level.
Christy, your mic's not muted.
Oh,
Sorry, Florence.
No worries. Braids are cool too. So for the region 2, which is it's encompassing Lincoln, Benton, Lynn, Marion, Polk, and Yamhill County. As you can see, we had out of 98 ICU beds that are staffed, 5 are available at this time, which is 5.1% of all ICU beds that are staffed. And for the non-ICU bed, there is 4.7% availability throughout the region. So, you know, the 2 hospitals in Lincoln County have been very kind to send us, you know, their daily census. What we've been seeing is that definitely there is some trending upwards in terms of how many people have been hospitalized in this surge, and we have also seen quite a few deaths this month. Next slide, please. All right, thank you. So those are the cases as of this morning. So we have a total of 2,291 cases since the start of this pandemic last year, 100 hospitalization and 27 deaths at this time. When you see where we were and where we are today, it is really still difficult to believe. So we passed the 7 times our July count. We have 731 cases as of this morning. Our incidence rate, 619 new cases per 100,000 over the past 7 days, which is more than 3 times the extreme risk capacity from the risk framework that we were following a few months ago. And our test positivity is 28.3%, which is really, really high. Next slide, please.
Florence, if I may, to put that 28% in perspective, a year ago, if we had a 5% positivity rate, we were concerned. Is that a fair analysis?
It's a very fair analysis. Yes. That was 5% was considered the higher threshold that we would want to be very, very concerned about if we were to go over. So if we look at August figures a little closer, so we have 731 cases, 19 hospitalization in August so far. We discussed that 84% of them are not vaccinated. We had 3 COVID-related deaths this month. And this past week, we had 282 cases reported to us. If you look at kind of the distribution of the disease per age category and per week, so in blue is the first week of the month, orange the second, yellow the third, and this kind of like lighter orange the fourth week. You know, pretty much you're seeing quite an increase in all age categories, and actually more significantly in the 0 to 19 this past 2 weeks. And as well, what is concerning to me is also the 50s and 60s age range, because as you know, what we had seen last year was that really the older generations were more at risk to get sick and hospitalized and possibly die. Next slide, please. So why is this happening? You know, we think it's really a combination of various factors. One, we have a variant of this virus that is very transmissible and contagious. And it is about 3 times more contagious than the previous variants. In the past, 1 person would infect about 2 to 2.5 people. With this variant, 1 person can infect between 5 and 8 people at a time. So because it is more contagious, it spreads faster, and this is also why you're seeing those very steep curve and increase in numbers. Although, you know, Lincoln County, we've done a tremendous work vaccinating our community members, still, you know, we don't have enough people vaccinated to really stop this virus from spreading. And as you can see in the little graph on the side, the vast majority of people who are getting sick these days are not vaccinated. We have about 86% of folks who are getting sick who are not vaccinated or not fully vaccinated. And then another major contributor was the lifting of the restrictions at the beginning of summer. You know, everybody was hopeful, and we started gathering more. We stopped wearing masks, and the Delta variant came in, and we're now experiencing the consequences of all those factors. Next slide, please. All right, what we can do to slow the spread and further cases, hospitalization and death. One, you know, getting vaccinated is the measure that is the most effective against getting sick, and especially against getting a very severe iteration of the disease, against being hospitalized, and against death. So getting vaccinated is very, very important. And so either getting vaccinated for people who have not gotten any vaccines, or really finishing their series for people who are in the midst of it, or maybe who just got one dose and need a second one. The second really important protective measure is wearing a mask, especially indoors around people in public settings. So this is in addition to the protection of the vaccine. What we know now is that the vaccine is a very good protection. And then when you add a mask, you're adding that layer of protection to really ensure that the people around you are protected from possibly you spreading the virus. Regardless of your vaccination status, we know now that you can, if you have been contaminated with the virus and you're vaccinated, even though you can be asymptomatic, you're very much able to spread the virus as well as somebody who is not vaccinated. And also another important measure to take is to limit social gatherings and to maintain physical distance with people. Make sure that you're practicing your cough etiquette, even if you're wearing a mask. Make sure that you're practicing very regular hand hygiene. So those are kind of the steps we've taken over and over this past year and a half, and those are proven to work. And especially if they're applied, in combination with one another, this is what we're hoping will help slow down that surge and the spread of this particular virus. Next slide, please. Okay, so to move on to vaccines, there have been a few good news really on the vaccine front. One is that the Pfizer vaccine has received full FDA approval last week. And so this is excellent news, especially for people who were still hesitant and who were waiting for the full approval from the FDA. Another very good news is that for people who are either immunocompromised or immunosuppressed, about 2 weeks ago or 2.5 weeks ago, an additional dose has been approved for those individuals so that they can get a level of immunity, a higher level of immunity. And then we're hearing that likely towards the end of September or early October, we will be able to administer booster doses for high-risk individuals, and that would be for people who have received their second dose of vaccine at least 8 months ago. So we do not have a lot of details yet about this, and of course we would share with all of you as soon as we have more details. But we are expecting booster doses likely this fall. And then we're also expecting the vaccines to get the emergency approval for kids between the ages of 5 and 11 years old. And we're expecting this emergency use approval this fall as well. Next slide, please. Okay, so how are we doing in Lincoln County? I mean, like I said earlier, we've been doing really amazing, almost 60,000 doses administered in Lincoln County since January. Interestingly, we had seen a drop really, especially over the beginning of the summer. Nobody wanted to hear about vaccinations. And I don't know if you're seeing it, but after having plateaued for a little bit, we're seeing a slight increase during August, and you can see it in July. Our 7-day running average was about 40 doses a day. Then August 25th, the same average was 83 doses per day. And I just looked today, and as of August 29, it was 106 doses per day. So we're seeing more people, getting vaccinated, and so that's very, very good news. Next slide, please. So, about 76% of all of the people eligible to be vaccinated, so everybody age 12 and older have been vaccinated, which is really tremendous numbers. The graph at the top is the Lincoln County data, and the graph at the bottom is the statewide vaccination rates. And as you can see, we're comparing quite well to the state rate overall, and even doing better for certain age categories. But we still have ways to go to hit 80%. But I think based on all the partnership we're developing and, people being willing to get vaccinated now, we're hoping that we're going to be hitting the 80% and more hopefully soon. Next slide, please. So we have a lot of vaccination clinic happening in the county. Well, first, pharmacies are offering the vaccine, primary care offices are offering the vaccine, and we have been implementing mobile clinics since June of this year. And so to find out the latest schedule, you just have to go onto the Lincoln County website. And so the first picture is kind of the main page. Under the What's New tab, you will find a COVID-19 testing and vaccination. And then that would lead you to another page where you can just click on where can I get a vaccine? And from there, the current schedule would be published. Next slide, please. All right. Any questions?
Before I give Willie or Tracy a chance to ask some questions, Florence, do you know when or if vaccination clinic is scheduled for the Siletz area?
I can look. We had an event scheduled and it was canceled this past weekend. Let me look.
We've had several over the last couple of weeks, but we did have to cancel the one on the 28th because I canceled the car show, and that's what it was kind of tied to, the car show.
Well, it sounds like you're well coordinated with our public health department on scheduling them. So I know when it works, our people will be there.
Right,
That's
exactly. And
we'll keep...
I don't see anything in the schedule right now. The closest to you is going to be in Otis on Wednesday. But anytime you would like another clinic, we can make that happen.
Any questions, Willie?
No, I don't. I've seen all of this. Plus, we have Susan who keeps us very, very, very informed, which has been great. It's been a nice, refreshing person on the council. So we're getting plenty of info. I was really hoping other council members would be here to hear the stuff that I hear behind the scenes, but I'll share with them.
All right. Well, if there's no more questions for Florence, we'll let you go. I know you have a commitment, and thank you for being here this evening.
Of course. Thank you very much. All
right. Next, second item on the agenda is police update. And we have both Sheriff Landers and Lieutenant Vertner with us. And I'll turn it over to the sheriff.
Good evening. Thank you, Commissioner. I know that I received some bullets regarding the policing topic that I can run through, and I'll probably pass the baton on to Lieutenant Vertner here in a couple of them. But first bullet was, how is staffing in the county? I know generally the staffing is difficult, especially some of the larger departments and offices like ours. Specifically for ours, the next question was, are there open positions, open officer positions? We do have several open deputy positions. Specifically in patrol, we will be in just a couple days, 5 deputies down, 6 if you count code enforcement too. And just to kind of put it in perspective, our patrol division has 1 lieutenant, 4 sergeants right now, 2 detectives, and then 22 deputies. So we're 5 of the deputies down, which out of those 22 deputies, 13 are general fund and the others are contract areas. So really we're 5 FT down out of 13 general fund deputies. So yeah, it's not good, and we're just trying to do whatever we can to fill those positions. And that kind of segues into the next bullet, which is, if so, do you expect to have new officers soon? And the answer is yes. We expected them sooner than we thought. We have actually 2 people selected to go into those positions. However, we just recently found out that the academy pushed out the academy date to November sometime now. So we've postponed hiring them, and actually both of these are transferring, one from the jail and one from code enforcement. So we're just hold off and keep them in the positions that they're in until just a few weeks before they go to the academy. So the academy is experiencing COVID delays and other delays there, which is, again, it already takes, when you're having a 16-week academy and then 15 to 17 weeks once they get out. You can just see pushing that out even further is really detrimental to what we're trying to do, and it's just kind of a domino effect. We can't ever really get above water with it, but we're definitely trying and working on those things. So I'll turn it over to Carl on the next one. What can be done to fill vacancies in Siletz contract when there's vacation time, or when Deputy McGuire, who is one of the deputies in the contract, is dealing with a search and rescue? I know we've talked about this, and actually it's really good topic. I'm glad the mayor brought it up. It's something that we need to look at. Deputy McGuire was just recently, since July, has had 2 very extended search and rescue missions. He is our search and rescue coordinator. It's also Siletz, but to fulfill the contract, search and rescue, unlike vacation time, which is kind of built into the contract hours, because that's typical. If if there's a city police or whatever, you'd have vacation time, but you wouldn't have search and rescue time. So I'll turn it over to Lieutenant Bertner to talk a little bit more about that now that that's been brought to our attention too, how we can deal with that.
Yes, thank you, Sheriff. So when a situation comes in search and rescues, we kind of know as soon as they come out whether it's going to be at least something that Bruce needs to be a dispatcher assigned to. Of course, we don't know the extent or how long he will be assigned to that. So the last one, which was this last week there at Olala Lake, a young man went missing. He was missing for 2 days, and Bruce was on that search for 2 days as well. One of those days was his assigned day in Siletz. The other day was his day off. But for future references, what we're doing is we are going to go ahead and try to backfill that position with somebody to be in the city of Siletz or on that contract if we know there's going to be an extended period of time. Of course, those just come up as they go. We don't get to choose when people go missing or any of that standard. So we will backfill that. But again, as far as his training or personal time off, we do not plan on filling that immediately. We will just like with any contract, you just have somebody out for the day.
And just kind of touch a little bit, and I know it's a little bit. I think Deputy McGuire does a great job out in Siletz, and he's really made himself available almost any hour, which is it's pretty outstanding. And I know, Mayor, you have a pretty good relationship with him, can get a hold of him without going through dispatch at any hour. So that that's good and bad, because when he's on these things, or if he is off, sometimes he wants to take care of things and Siletz himself. But I guess what I would also stress is, if there's a call that comes in, or if you have something that needs to be taken care of, please don't hesitate to call dispatch also, because they'll put that call in a queue. And even if Bruce isn't there, if we don't have a Siletz person on, somebody will take that call and address whatever issue that is. And so I think that's, just make sure you know that you can call dispatch also if Deputy McGuire isn't readily available for that. So I just wanted to remind you of that. And the last issue I think that was on there, and I'll turn it over to Lieutenant Bertner again on this one, was some speeding issues in Siletz.
Correct. So during one of my meetings with Tracy there, I see her pretty frequently Monday through Friday as I take my tours to town. As she expressed concerns that there's been some speeding going on in town. And she asked what can be done. And I said, well, first we need to find out really is the speeding happening. And I know that the County Roads has our traffic study equipment. And so I set Roy up with the mayor there, and they got it instituted. The traffic study was done for a week, 2 weeks ago, and the results came out. It was conducted on Buford, and they're select right in front of the city hall, and which happens to be a short section of the school zone. So the speed limit's actually 20 miles per hour. During that week, there was just about 6,000 vehicles that actually crossed in front of the measuring device and measured an average speed about 24 miles an hour, kind of depending on which percentile you're looking at. It would be either 24 or 26 miles per hour for the average speed of the vehicle. That in of itself isn't egregious, especially if it is outside of normal school hours. 5 miles an hour over the speed limit is not something that we stop the typical person for unless we see aggravating circumstances such as children present or poor driving behavior. So that's not something that we would designate extra personnel time to address a 5 mile an hour over the speed limit. During that time frame, and the stats were shared with the city of Siletz as well, there was one vehicle documented at about 40 miles an hour. Of course, that would always gather our attention, but certainly not the normal. That was just one of them in that speed range. Now, that was kind of the results that I drew from the speed study, and I'm interested in having that discussion, how the city interprets the speed there on Buford.
Tracy, you're there all day, every day. So I'll let you go at that question if you would.
Well, it has gotten better, but Bruce has been making it a point to sit out there for a few minutes, maybe even probably longer than that, a majority of his day. So he has had a presence there, and it has slowed down quite a bit. But it seems to be they know the schedule. So as soon as he's gone, it just ratchets right back up again, which is really nothing you can do about that. Like I said, they just kind of know when he's in and out of there. But for this week that I've seen, it slowed quite a bit, especially during the day, and our kiddos are getting ready to go back to school. So it's actually the prime time for him to be there, anywhere between them going back to school and then lunchtime to probably between 1 and 1:30 is when we seem to have the most issues.
Okay, thank you for that.
Any other questions or comments for the sheriff or lieutenant?
I do not have any others.
I do not either.
All right. Well, thank you both, Lieutenant Vertner and Sheriff Landers. Appreciate you taking the time this evening. And I guess I will say I sense that, well, there's still a few I's to be dotted and T's to be crossed out in the Siletz area. It's a vast improvement from the way the situation was prior to the law enforcement coverage or extra coverage. So that's good work.
I think it's a good thing we're talking about speeding. I think that's the positive piece about it. Yeah.
That's what I was just about to say. The fact that we're talking about junk in properties, junk in front yards, and speeding instead of
you guys froze on
park.
me.
Yeah. Thank you.
Yeah.
Hello.
I can hear you. Can you guys hear me?
I can hear you, but I'm the only one, I think.
I can hear you.
I think
I hear you.
yeah, frozen.
Commissioner Jacobson, can you hear me?
I can hear
Yes,
you.
I can hear you. Sorry, I was trying to get my mute off. I can hear you.
Hey, I just wanted to thank you for helping me through the dilemma I was having with whether to have the car show or not. That was a tough one. We put a lot of time and effort in there and really wanted it to happen. But in light of everything that's gone on since then, looks like it was absolutely the best decision. And I just want to thank you for being my sounding board and listening to me and
Oh,
giving me some advice.
You're welcome. I know it was a really tough choice, but as I said in the email to you, I just really appreciate your diligence and awareness towards public safety. So I'm glad you reached out. I know it was a hard choice. I know there were people disappointed, but thanks for being aware of what was going on and making the tough call. So you're welcome.
Awesome.
You're muted, Commissioner Hunt.
Yeah, well, I was saying I vanished, or at least people vanished in my screen, and I'm back. And now I'm unmuted.
Even better.
Yeah. All right. Next on the agenda would be county funding. And I know, Kristen, you'll try to give a general idea what's going on. And I don't know, Commissioner Jacobson, you may have something to add, some of the activities you're involved in, but County Council Yule.
Well, thank you, Commissioner Hunt. So I know that the request from the tribe or from the city of Siletz was what new programs have we started? We don't really have any new programs. I can just speak generally about like the ARPA funds, which is the American Rescue Plan Act funds. So we did, we were awarded those. We are using those basically to deal with lost revenue and restoring positions that maybe had been cut during COVID. Other options that you can use those funds for are for premium pay for essential workers. So we've looked at all of that and we've used the funds for that.
Recently, I would also add, sorry to cut you.
It's okay.
I'd also say we're still using the funds to actually fight COVID. That's our largest expense we probably have at this point.
Right.
Yeah,
So,
that makes sense.
Yeah. So the CARES Act, which was passed last year, that is used for COVID testing, public health, basically supplies and testing. I don't know if you have any specific questions about like the ARPA funds. I know that the tribes were awarded those. I don't know if the city applied and was awarded ARPA.
I'm going to have to interrupt and step aside. I've got a fire or smoke alarm going off in my house. So I am
Okay, so I guess as vice chair, I step in to steer the discussion, but Council Ewell, please continue.
So the county also recently is going to be using the ARPA funds to provide a bonus to individuals, employees who have been vaccinated, and then also allowing opportunity for people to obtain the vaccination. So that just one example of how we're using the ARPA funds. I know this, oh, sorry, I got a puppy here. Oregon also made available municipal wildfire assistance program funding. So we actually just had a meeting regarding that recently, actually today. So I don't know if there's any specific funding that you guys were looking at or what the city applied for, if there's something you were thinking we can team up on. I'm not sure, but your question.
No, I didn't have anything specific. I was just, I know that we've been putting out grant applications and other things and struggling to get anywhere really with that. And I just wanted to know what other folks were doing. So I know if we're going in the right direction or what.
Yeah, I would just add that our, we had several grants we had applied for as well. Our capacity internally is really limited right now, was both because of COVID and wildfire stuff. And so we're at this point kind of prioritizing, COVID and wildfire resources. So we do have some funding sources out right now, several specific to fire. So we did have our fire post-hazard mitigation grants that went out through emergency management. Those do require a 25% cost match, but those are out the door. They're difficult to write. We actually did have to hire very specialty help to help us get those out. We also were very fortunate in the Christmas tree bill that the Oregon legislature passed, which included about $16 million that will be coming to Lincoln County for various wildfire recovery projects, septic and well water repair for wildfire survivors in Otis, as well as a bunch of money that passes through us onto Panther Creek Water District for some work they're doing about putting in fire hydrants up to code and redoing the piping system underground that ruptured and burst during the fire. So there is some resources coming in, but like I said, at this point, we've had to kind of be hyper focused on COVID and wildfire stuff.
Yeah, that makes sense. Excellent.
Anything else, Willie, that you would like to discuss? We've got a few minutes left.
I don't think so, unless Tracy has anything. I just like I said, at this point, policing is going to be high on our agenda always until we feel, well, I guess we feel a lot more comfortable, but we'll never be perfect, but it's always going to be high on our agenda. And then finances, with such a new staff, we're trying to really figure out what we have and have not been a part of in the past that maybe we should, and trying to just look at things with new eyes. So that's really where my question comes from in those respects.
Okay. Well, since we've got a minute, you may be aware of this, but of course, going back to the COVID situation, there is an agenda item on our Board of Commissioners agenda for Wednesday that will address 3 things that we as commissioners are doing to really, in a way, say thank you to all of our public health workers and other county employees that have really gone above and beyond the call of duty during this COVID period. Certainly the demands on their skills and time are unprecedented, and in a way to say thank you and in a way to recognize them for their dedication. I expect we'll be approving on Wednesday 3 things, and you may be aware of this, but I'll discuss them briefly. Every county employee will get up to 80 additional hours of leave for COVID-related needs. And that will be independent of their sick leave. So our employees that come down with a virus will be able to stay home and take care of themselves and not impact their personal sick leave.
Nice.
Second of all, we have purchased, we've already made the purchase of 900 self-testing kits for use at home. These kits will be made available to employees at no cost. The number is really representative of about 2 free kits per employee. The health center and the sheriff's office have access to free kits. So when we combine those resources, we're getting somewhere in the neighborhood of about 1,200 kits for our roughly 600 employees. And the third thing, of course, is we are taking ARPA money and we are providing a $500 bonus, or will be, assuming it's approved on Wednesday, a $500 bonus to basically every county employee that is fully vaccinated or provides proof of being or is fully vaccinated by October 31st. And in order to get that bonus, all they need to do is provide a copy, proof of their being fully vaccinated to our HR department. We expect those bonuses will be paid in November. So a couple of things we're doing there. In addition, we've gone back to remote work wherever practical. We are all meeting virtually and practicing social distancing, and have asked county employees to limit their travel on county business. So a little bit of information on COVID since we had a moment. Anything else, Commissioner?
No, that's great. Thank you.
All right. Well, thank you, Willie. Appreciate the good work you're doing out there. And as I've said, you don't need to wait until the next meeting a year from now. Feel free to call us if we can help. And appreciate everything you've done out there.
Well, I appreciate you guys too. Thank you very much. And I hope you guys have a great evening.
All right.